Kansas. Go to Brianna from West Harrison. Deanna, excuse me.
Yes.
Deanna, what's your question?
Okay, my question is, the symptoms of the coronavirus have been, compared to the common cold. However, how are people dying then if the symptoms are so mild? Do they have underlying health conditions, or what is the reason?
Good question.
So some people are getting pneumonia. The pneumonia gets severe and their lungs fail. That's how people are dying. So a lot has to do with your own body's immune system. Children seem to handle this just fine. Their immune systems are young, their lungs are healthy. We're seeing a lot of men in China who are heavy smokers getting sick, getting hospitalized, potentially dying. The older you are, as you get elderly, especially if you have chronic medical conditions, if you're on medication that suppresses your immune system,
COPD,
you're at greater risk. Yeah. Yes, certainly the lung conditions, if you're a smoker, this is an excellent time to stop because it definitely makes you more vulnerable to these viruses.
Okay.
And also, I would add vaping. We've seen, sorry.
Excellent. Yes, please continue.
We've seen a lot of chronic lung injury that has been associated with vaping. And, we really don't understand how that is going on, but we know it's injuring the lungs. And that has caused significant illnesses in young people and significant damage in young people's lungs. And so we really, if that is smoking and vaping is something you really don't want to continue if you want to protect yourself from these kinds of respiratory viruses.
Excellent point. A lot of parents right now are applauding that answer who are concerned about their kids vaping. Okay, speaking of kids, we have Nadine from Harrison who has a question about pregnant women. This is for you, Dr. Nolan. Nadine.
Hi, I was just wondering, are there any known cases of pregnant women infected, and is there any risk to the developing fetus, or would the woman be in more danger if she gets infected?
So based on, again, the bulk of the data we have is all out of China. And, as we've said, the younger you are, the sort of less affected. Rates of severe illness in people under 30 is incredibly remarkably low. So, your peak sort of childbearing ages, there are people in their 30s who are pregnant. We've not seen that sort of pulled out as a statistic associated with more severe disease. We know with influenza, people who are pregnant are definitely at risk for more severe disease, but we've not seen that, and whether that's just because they haven't been infected, whether they haven't, we just haven't had the numbers to sort of pull out whether or not that's a statistically significant risk factor. We haven't seen that yet. Obviously that's something we look at because, pregnant women are a vulnerable population and we want to protect them and the infants they're bearing. And so we definitely will be, people will be looking at that and continuing to, see if that's a potential risk factor. And, obviously when you're pregnant, you do everything you can to maintain your health for your own and your child's safety. And so, continue, unfortunately, this mantra of great hand hygiene, stay away and avoid the sick people when you can. Even at home, it's hard, especially, I'm a mom and I have, when I was pregnant, trying to avoid my other children when they were sick is nearly impossible. But, again, good hand hygiene and washing their hands and washing your hands and doing your best to avoid coming in contact with respiratory secretions.
Okay. That was a great question there. Let's go to another great question. Mario from Nanuet wants to talk about the warm weather. Mario.
Yeah, hi. We're moving out of winter and into spring, so I was wondering how the change in temperature from one season to the other might affect how this whole thing unfolds.
Dr. Kohl, there was some thought that, generally speaking, the flu hits us in the fall. Sometime late winter, it starts to disappear. What is the thoughts with the coronavirus?
We're certainly hoping that this coronavirus is going to behave the same way. People will be outside, be a little healthier, not indoors coughing on each other. So we're hopeful that it will start to peter out.
But what are the chances that this can come back perhaps next fall when it comes back again?
As long as it's still in people or someone goes to a live animal market and gets it again from an animal, it can always come back, which is why the vaccines are are so exciting, and we're so hopeful for being able to prevent it.
The lesson here, don't be lulled into a false sense of security just because the weather is getting warm.
Right. And hopefully in the fall we'll be able to test for it much more easily, but you know, if we're lucky, it goes away. If we're not, we'll see it again.
We'll have a little bit of time. It does buy us some time, though, does it not, if we can get a
Absolutely.
vaccine or something like that going? Okay. All right. Let's go to Paul from Garrison. He was just actually in Singapore. Paul, what is your question?
Well, I just want to know if we're going to do any changes here, because I was in Singapore from the beginning of January when it first started in China, and I've seen so many things over there that I haven't seen here. For example, they took my temperature before I left Singapore airport, landed in New York, and actually in Newark, and they didn't do any screening as far as temperature or anything. And I came in on February 25th. And also, over there, schools, hospitals, places of business, people they take temperatures. In offices, they take temperatures twice a day, and they have to log this. Also, the issue with masks, I know they say don't wear a mask unless you're ill, but in situations where people can't get masks and they are ill, what do they do in that situation? I know they say stay home and don't go out, but sometimes they don't know if they have the virus or just a small cold, so they go about their business. So I just wonder if they're going to make any changes here. I'm sure they probably will, but it seems like we should get ahead of this as soon as possible.
Dr. Nolan, a couple of things in there. First off, when it comes to the masks, people have been wearing the masks, but from what I understand, they are useless for anything but perhaps preventing other people from you spreading it to someone else. Is that correct?
So useless is, you know, they're probably not so useful. Yeah, you know, if you have respiratory symptoms, to cover your mouth with a mask is an excellent idea. If you do have to go out somewhere, if you have to go to the doctor's office and because you feel sick and you need treatment and you need to be seen by a doctor. But you know, this is a global issue, and so there are limited supplies of masks. Right now, the U.S. does have stockpiles, but it depends a bit on how severe this outbreak gets. So we don't want to be using masks when we don't need to. There's some data about when you wear a mask, you actually touch your face more, and so really the one thing you want to prevent is touching your face and what we call your mucous membranes, sort of along your eyes, your nose, and your mouth. That's how the virus gets into your body and gets into your system. And so we definitely, you want to prevent that because the masks get uncomfortable, they get itchy, they get soiled, and the outside of them gets contaminated as well. So it's not really that they're, extraordinarily protective in a normal day-to-day environment.
And Dr. Kohl, Paul was also asking about testing. Should we be doing more to test people coming in, doing some sort of temperature test, something like that, to see if, because now that this is a global sort of a situation, and it is not just in Italy and Iran and China, that's in a number of countries.
Yeah, he mentioned Singapore, which is interesting because the Singaporeans, it's a very compliant society. So I think it's a little easier to get to say to people, do this twice a day, keep logs. Americans might be a little tougher to get them to comply with that. As far as screening people, it's never a bad idea. I don't know where the government is going with it. Remember, with this virus, you don't necessarily have a fever right away. You could easily lull yourself into a false sense of confidence that, well, he doesn't have a fever, he's okay,
right.
And then the next day somebody's ill.
Right.
So, the more screening we do, the better to try and limit the spread, but
we'll have to see. Okay, Mary from Yonkers, I understand you have a question about asthma and the coronavirus. What is that?
Yes, thank you. I was just curious. I know they're talking about underlying conditions, people with COPD. I have asthma. I just got over the flu, and it gave me bronchitis, and they put me on prednisone. So what does that mean for people like me who have asthma that get this virus?
Dr. Kohl.
Any respiratory condition makes you a little bit more susceptible. If you're an asthmatic who's not currently ill and you're not taking prednisone, that's good. Your risk is probably not much higher. If you're in the middle of an asthma flare and you get an infection, that can be worse, especially if you're on prednisone, which does suppress your immune system a little bit. So I would say for asthmatics, try and keep your condition tightly controlled so that you're breathing easy, that you're not, that your chest is not tight, you want to be in the best condition you can be.
And Dr. Nolan, any thoughts on that from the pediatric perspective?
Sure, absolutely. So, again, that tight control of your asthma. Call your pulmonologist or your pediatrician and make sure you have your inhaler refills up to date. Make sure you have your controller medications and you're taking your controller medications if you have underlying asthma and need that. And allergy season's coming up as well, so that check-in, making sure your asthma control plan is up to date and you have the necessary medications now that you need, so that if perchance you do get infected and you do have an exacerbation, that you don't need to urgently run out to the store and just make sure that you have everything sort of under control and get your plans organized as best you can.
Yeah, you want to have a few backups right now, don't you? Okay, Bill from White Plains, I understand you have a question. Bill.
I do. My question is that I understand that 12,000 people will die from influenza more or less in the country this year, and that 80% of the coronavirus are mild symptoms. So why is this being treated so much more seriously than regular influenza?
So, Bill, that's a great question.
That's a great question, Bill.
It's much more than 12,000 people are going to die from flu this year. Every year in the U.S., we have probably between 20 and 60,000 people dying from flu, just what everybody thinks is a regular flu.
We had 2 years ago, it was a particularly terrible year for flu, correct?
Yeah, there are years that it really hits children, there are years that it hits the elderly, there are years that it gets people in good health. And we can't get Americans to take the flu vaccine. Everybody's got a reason, and we get less than 50% taking the vaccine every year. So it is an interesting question. We don't know yet how truly lethal or dangerous this coronavirus is going to be. We're going to learn a lot more about it, but we should be afraid of the flu. All the things that we're talking about that Scott's promoting, the hand washing, covering your cough, not coughing on other people, staying home when you're sick, we should be doing that with flu. We don't take the flu seriously enough.
Excellent. Okay. And I think the answer to his question is that we just don't know. That's probably why this is getting so much attention, because people are dying.
It's exciting. It's scary. Every time there's another death, it's making the news. No one stops and says, well, we're up to 25,000 deaths already from the flu. There's another 18 in a nursing home, because that happens in nursing homes with flu too, where you may lose 10, 15, 20 people.
Okay.
I think it's new and it's unpredictable at this point, and I think that's why it's getting as much media attention as it does. I would love if the flu got as much media attention every year, just because it is the severe outcomes from flu are preventable with vaccines, and we are still seeing a fair amount of flu. This has been the worst to date. There have been more pediatric deaths reported in the country at this time in the season than since 2009, when we had the H1N1 pandemic. So the flu is definitely much more of a risk to your children, and it is not too late to get their flu vaccine. Pediatricians still have that vaccine in stock. So we're all looking for ways to help ourselves stay healthy right now, and so if you haven't gotten your flu vaccine this season, please go get it. Your pediatrician will be very happy to give it to you.
So if there's one plus from all of this attention this has been getting, is that we should be reminding people that the regular flu is also very dangerous.
Yeah, and
Absolutely.
Personal hygiene is critical for this. I'm at CareMount, and in our practice, we were seeing in the last couple of months between 1,000 and 1,300 people just in our practice coming in with flu, which is really crazy numbers.
That's a lot. That's a lot. Okay, let's go to Elisa from Mohegan Lake. She's got a question about her son, who actually just had heart surgery. I think we'll have Dr. Nolan take this one. Elisa.
Yes, hi.
What is your question? Elisa?
Yes, I'm here.
Yes, what is your question?
Okay, my question is, my son just had a heart transplant. Hi, my son had a heart transplant,
you.
and
Yes.
it's immune. Hello?
Yes?
Yes. My son had a
Yeah, turn off, if you could turn it on
and
your
he is
TV.
immune compromised.
Okay. Yeah, if
Hello?
you could just lower down your TV, then ask her, so your son is immune compromised, he had a heart transplant. What is your question?
Sorry about that.
That's okay.
Yes, he's immune compromised, and he's using all the universal precautions that you are suggesting. I'm wondering, if someone's immune compromised and not sick, are there extra
Precautions?
Yes, he's using all the universal. Is there anything extra that he could be using to make him safe?
Fair. Good question. Dr. Nolan.
Sure. So, he's in a very special situation as opposed to everyone else, or, the majority of other people. And so, we would presume, because of his immune compromised state, that he is more at risk for a severe complication with this virus. So, I would say, depending on how long ago the transplant was, and, there's sort of degrees of that immune compromise. And I would say absolutely reach out to his doctor specifically to understand sort of, his level and what they suspect his exact risk factors are. But I would say, potentially limiting, large community gatherings and that sort of thing as we sort of see how this outbreak unfolds. And I think, as we get much more testing, we'll have a much better idea of sort of where this virus is in our communities and how much of a threat it is specifically, in your area. Limiting travel and limiting areas of known disease is probably a good idea for him.
But the answer to her question and everybody else's is there's really no magic bullet, right? That's really the answer here.
Really, all you can do if you want it to be perfectly safe is stay away from other people, but you still have to live.
Right. That's not an option for a lot of people out there. All right, Adrian from Peekskill, I understand you have a few questions. Adrian, go ahead.
Yes, I do. Well, my first question is, I was wondering if it's recommended to travel domestic within the United States.
Good question. A lot of people wondering that right now.
There's no recommendation not to travel domestically. Again, we don't know exactly how far the virus is spread or where. Take the same precautions. If you're in an airplane, you might want to, if you have an antibacterial wipe down your seat. Try not to sit next to anybody who's coughing or sneezing. But right now, there's no restriction against domestic travel.
Okay. What is your next question, Adrian? No, Adrian, that was your question. Okay, let's hear from Jim C. Has 3 kids with allergies. I think we'll go to you on this one, Dr. Nolan. Jim.
Hey, good evening, everyone. And by the way, this is the most productive show I've seen on coronavirus so far.
Well, we're trying.
My question is, I have 3 kids that have heavy allergies, and they're heading into the season right now with spring. So what should we be looking for, and how should we prevent it?
Dr. Nolan.
So as far as, allergies go, this is predicted. We've had a sort of very mild winter, and what I've heard from some of my allergy friends is that they do anticipate this being a heavy allergy season. I know people have complained already that they've had pollen and seen pollen and started to have symptoms themselves already. So definitely touch base with your allergist or their pediatrician and make sure that you have medications on hand, whether you're taking a prescription medication or over-the-counter Claritin or something like that. If your child also has asthma or reactive airway disease, make sure you have those rescue and control the medications. And I think we may have lost.
We may have lost Jim, but those are good answers right there. Okay. Thank you very much for that question, Jim. Do we have, we got Bernie from Suffern. Bernie, are you out there?
You kind of touched upon this.
There we go. I'm sorry. Try again one more time, Bernie.
Can you hear me okay?
Yes, we can hear you just fine.
Okay, I touched upon this question. You touched upon this question before, but given the current parameters, do you have any estimates as to how long this epidemic might last? When do you think it might start unwinding?
Dr. Kohl.
We don't know. Anything we say about that is a guess. I'm really hoping for the nice warm weather to really tamp things down, but we don't know yet.
Is it the warm weather should help if we can get a vaccine? That should.
If you can get a vaccine, you can get control of the infection.
The question is, can we get the vaccine before the cold weather hits again? Is that kind of where we're at?
Yeah, that's where we are. With a little bit of luck, the warm weather comes, the virus starts to fade in the population. If we have a vaccine or if we have one of these drug candidates potentially, at least we can treat it. But there's intense research going into this right now, so hopefully we'll either have a vaccine or a drug or both.
Gotcha.
Okay.
And
I wouldn't downplay the role of good infection control measures. In Hong Kong and in other areas of China, they've really been able to stem this, and even in Wuhan itself, they've really been able to stem the spread of this infection. And when you look at the sort of the case totals, I think it was just last week, there were about it was the first day that there were fewer cases reported in China as compared with the rest of the world. So China has really gotten this under control without treatment, without a vaccine. And so good infection control measures can do that. Some people may think, some of them that we've heard about are a little draconian as far as, quarantining people and people needing to stay indoors for long periods of time. But I think, we really need to follow the guidance from the Department of Health and follow the quarantine measures and try, because we will have testing soon, and I think we'll have a much better handle a bit quicker than the Chinese were able to in order to get this outbreak under control and really understand how far it has spread and what communities it has spread to, and really focus intense infection control measures on those communities. And I think we'll be able to stop it. I'm super hopeful for the vaccine and for other treatments as quickly as we can get them done. But clinical trials will still take time, and we need to make sure, the products we put out are safe for people as well. So I think, I'm hopeful for this change in the spring weather as well, but as we saw in 2009, the flu pandemic came at a completely abnormal time for influenza. And so even though coronaviruses, the ones that normally circulate and cause the common cold, tend to be winter months, I don't think we can rely on the prediction that the spring weather will help to stem the spread. And so, we really need to follow those infection control measures, the hand hygiene, the respiratory hygiene, stay home when you're sick, and follow any instructions from the Department of Health as far as quarantine.
So you're a big believer in the quarantine. As tough as I imagine that is, to stay indoors for 2 weeks is the right thing to do.
It's been demonstrated to work in China. So I think, right now, since we don't have effective treatments and vaccines, we really need to rely upon those measures.
Okay, good advice. Thank you for that. Rich from Yorktown. Rich, what is your question?
Hi, yes. I was curious, given the situation we're in right now, what is the recommendation about attending large events where you may not be able to wash your hands often and social distancing is just not available?
Another good question, because spring's coming. People are going to be going to, outdoor events, or people are ready to go outside now that the winter is almost done.
So the government may have recommendations on this. They may just not allow, depending on the spread of the disease or the spread of the infection, they may not allow big events to occur. If you've got high prevalence, if there's a lot of the virus in your area, they may say, well, we're not going to have those events. If you have personal risks, if you are someone like just had a heart transplant, I would probably think twice about going to a big event where you can't keep your distance from people. So a lot of it's going to be personal judgment. Clearly, you're at greater risk when you have large numbers of people on top of you.
So it really comes down to how much risk are you willing to take?
Right.
Right.
Or how much will society allow you to take?
Okay. I think we have time for one more question, and it was, who is this? Charlene from Dutchess. Charlene.
Hi, how are you?
I'm good. What is your question?
So unfortunately, China is locked down with social media and putting anything out there. But I saw some disturbing videos, and I just want to know that are seizures and seizings part of this coronavirus?
Interesting. Okay. Dr. Kohl, we're running a little bit short on time. Have you seen any of that?
Not that I've seen in the literature.
Okay. And Dr. Nolan, you have not seen that either? All right.
No,
yeah.
not seen that.
You got to watch out what you see on the internet, that's for sure. Do we have time for one more question? Have we got one other question from, say that again? Corinne. Okay. One more quick question. Corinne, what is your question?
My question is, I live in New Rochelle, and I work in a middle school here. I'm the grandmother of 2 brand new grandchildren, and I'm really Hi.
Go ahead. Go ahead. Turn your TV down.
And I'm really concerned if I should be staying away from my grandchildren. What should I be doing as a precaution to protect them?
Dr. Nolan, why don't you handle that? And we did sort of touch on this a minute ago, but go ahead.
So again, with with pediatric disease, we've really not seen reports of significant disease. So again, do your best. You wash your hands before any newborn. Newborns are at risk for lots of things. So before you are in contact with your grandchildren, obviously wash your hands. If you're feeling sick, stay away. But otherwise, I think you should enjoy your grandchildren.
Okay. This has been great, guys. That was the fastest hour we ever had, but I hope a lot of people got their questions answered. That is all the time we have. I'd like to thank our in-studio guests. I'd like to thank our viewers out there, all those people who called in. Now, some phone numbers for you to take down. If you're under self-quarantine, you can call the hotline 666-588-0195. We'll be right back.